If you climax and nothing comes out, I want you to stop scrolling right now. I'm Dr. Alaric, and for some men over 45, this is harmless. For others, it's the body waving a red flag. And here's the scary part. Most men ignore it until it's too late to reverse. So if this has happened to you even once, stay with me for the next 20 minutes. What I'm about to share could save you years of confusion, or worse. I know this topic makes men uncomfortable. I get it. But I've been practicing urology for over 2 decades, and I can tell you this, you are not alone. And more importantly, you're not broken. What I'm going to explain today is simple, practical, and actionable. Here's what we'll cover. First, why this happens more often as men age and what's actually going on inside your body. Second, when it's completely normal and when it's not. Third, what you can safely do starting tonight to understand what's happening to you. And finally, the one sign that means you should not wait another day to get checked. No shame, no judgment, just clarity. Let me start with something most men don't realize. Orgasm and ejaculation are not the same thing. Orgasm is the feeling, the pleasure, the release, the climax. That's controlled by your brain and nerves. Ejaculation is the fluid, the semen that's expelled. That's controlled by muscles, valves, and pathways in your pelvic region. As men age, those nerves can weaken, those muscles can lose their coordination, and those pathways, they can misfire. Sometimes, semen goes backward into the bladder instead of out through the urethra. We call that retrograde ejaculation. Other times, the body just doesn't produce enough fluid anymore, or the muscles don't contract strongly enough to push it out. It's mechanical, it's biological, and most of the time, it's manageable. But you have to know what you're looking at. Let me start with the good news. Not every dry climax is dangerous. In fact, in my clinic, I'd say about half the men who come to me worried about this walk out reassured. Here's why. As you age, and I mean naturally age, the muscles around your prostate and bladder lose some of their tone. The nerves that coordinate ejaculation, they slow down. The reflexes aren't as sharp as they were at 30. This is normal wear and tear. It doesn't mean something is broken. It just means your body is changing. I also see this in men who've had prostate surgery, especially procedures for enlarged prostate, like a TURP. Those surgeries can affect the internal sphincter, the little valve that keeps semen moving forward. After that kind of procedure, retrograde ejaculation is incredibly common, and for most men, it's expected. It doesn't hurt, it doesn't reduce pleasure. The semen just takes a different route. Then there are medications, alpha blockers, certain blood pressure drugs, some antidepressants. They can all interfere with the muscles involved in ejaculation. If you started a new medication 6 months ago and suddenly noticed this change, that's your first clue. Let me tell you about James. James came to see me 2 years ago. He was 62. He told me he hadn't seen any fluid during climax in over 3 years. No pain, no discomfort. Sensation was still there. He just wanted to know if something was wrong. We ran a simple urinalysis after orgasm, checked his urine for the presence of semen. It was there. Retrograde ejaculation, completely harmless in his case. He'd had prostate surgery 5 years earlier. This was just a side effect he hadn't been warned about. I see relief on men's faces when they learn this isn't a failure. It's not a loss of manhood. It's not dysfunction. It's just different plumbing. So if you're in this category, if there's no pain, no sudden change, and you know the likely cause, you can breathe. But let's talk about when you shouldn't. There are cases where a dry climax is not normal, where it's your body trying to tell you something is wrong. And the men who ignore these signs, they're the ones who end up in my office a year later wishing they'd come sooner. The first red flag is a sudden change. If you've had normal ejaculation your entire adult life, and then, seemingly overnight, It stops. That's not aging. That's a disruption. It could be nerve damage. It could be a blockage. It could be related to blood sugar issues or circulation problems. But it's not something you wait on. The second warning sign is weak sensation combined with no fluid. If you're not feeling much pleasure anymore, and there's also no semen, that tells me the nerves aren't firing properly. And that can be an early indicator of nerve degeneration, sometimes related to diabetes, sometimes to spinal issues. Third, and this one should never be ignored, is pain, pressure, or blood. If you feel pain during climax, or if you see blood in your urine afterward, that is not a normal variation. That is your body screaming for help. It could be an infection. It could be inflammation in the prostate. In rare cases, it could be something more serious. Let me tell you about Michael. Michael was 58 when he first noticed the change. No fluid, and the sensation had become dull, almost distant. He didn't think much of it. He told himself it was just age. He waited a full year before coming to see me. When we tested him, we found nerve damage related to poorly managed diabetes. His blood sugar had been high for years, and it had started affecting the small nerves in his pelvic region. He looked at me and said, "Doc, I thought it was just age." And I told him what I'm telling you now. Age doesn't mean you ignore your body. We caught it in time. He made changes, better blood sugar control, pelvic floor therapy, some adjustments to his routine. He got some function back. Not all of it, but enough. But if he'd waited another year, I don't know that we could have done much. If you're experiencing a sudden change, don't guess. Don't wait. Get checked. Now, let me tell you about the cause that surprises most men, the one they never suspect. Retrograde ejaculation. I mentioned it earlier, but let me explain it fully now, because this is the most common hidden reason for a dry climax, and most men have never even heard the term. Normally, when you climax, a small muscle at the base of your bladder, called the internal sphincter, closes. That forces the semen to travel forward and out. But if that sphincter doesn't close properly, the semen takes the path of least resistance. It flows backward into the bladder. You still feel the orgasm, you still have the release, but there's no visible fluid. Later, when you urinate, the semen comes out mixed with your urine. You might notice the urine looks a little cloudy. Most men never connect the dots. So what causes this? 3 big things. First, diabetes. High blood sugar over time damages small nerves, including the ones that control that sphincter. This is one of the earliest signs of diabetic nerve damage in men, and it's completely silent until it's already happening. Second, medications. Alpha blockers for blood pressure or prostate issues relax smooth muscle. That includes the sphincter. It's a known side effect, but most men aren't told. Third, surgery or trauma. Anything that affects the bladder neck or prostate can disrupt that valve. Let me tell you about Robert. Robert came to me at 67. He'd been experiencing retrograde ejaculation for about 8 months. No pain, but he was frustrated and worried. Turns out his blood sugar was borderline high. Not diabetic yet, but pre-diabetic. He didn't even know. We worked together. He adjusted his diet, cut back on processed sugars, started walking daily. Within 4 months, he saw improvement. Not a complete reversal, but the sphincter started functioning better. He told me, "I didn't realize my body was connected like that." And that's the point. This is why I never want men guessing. Your prostate health, your nerve health, your metabolic health, they're all linked. And when one system starts to falter, others follow. If you're dealing with this and you don't know why, the first step is simple. Get your blood sugar checked. Get a full metabolic panel. Let a doctor look at your medication list. Sometimes the answer is right there. Now let me give you something practical. Something you can do tonight or this week that doesn't require a doctor's appointment. I'm not asking you to diagnose yourself. I'm asking you to observe. Here's what I want you to do. Tonight, or the next time you're intimate, whether with a partner or on your own, I want you to notice patterns, not performance, patterns. Pay attention to sensation. Is it strong or has it dulled? Do you feel pressure building or does it feel muted? Pay attention to timing. Does the climax feel sudden or does it build gradually like it used to? And pay attention to your body afterward. Any discomfort? Any unusual feelings? Then drink water. Stay hydrated that evening. Avoid alcohol that night if you can. It affects nerve signaling and muscle coordination. The next morning, check your urine. Is it cloudy? That could be semen. This is observation. This is data. This is you learning your own body. It is not self-treatment. It is not diagnosis. But it gives you something concrete to share with a doctor if you decide to get checked. And here's the thing. Most men never do this. They just assume, or worry, or ignore. Don't be that guy. Now let me be very clear about when you need to act immediately. Not next week, not next month, soon. If you experience pain during climax, sharp, burning, or aching, that is not normal. That could be infection, inflammation, or a structural issue. Get it checked. If you see blood in your urine, especially after intimacy, do not wait. Blood is never a casual symptom. If you have a sudden, complete change, you go from normal function to nothing at all in a matter of days or weeks. That is your nervous system or your vascular system signaling a problem. And if you feel numbness, not just reduced sensation, but actual numbness in your pelvic region or genital area, that is a nerve issue that needs immediate evaluation. I've seen men brush these off. I've had patients tell me they thought it would just go away. It doesn't. Your body doesn't send random signals. It's trying to communicate, and ignoring it has consequences. I know this topic feels embarrassing. Quences. I know this topic feels embarrassing. I know it's not something most men want to talk about. Not with their doctor, not with their partner, not with anyone. But here's what I want you to understand. Your body is talking to you. It's not punishing you. It's not failing you out of spite. It's adapting, it's aging, and sometimes it's struggling. And ignoring it never ends well. I've sat across from men in their 70s who waited decades to ask these questions. Men who suffered in silence because they thought it wasn't manly to admit something was wrong. And I've seen the relief, the actual weight lifted when they finally get answers. You deserve that relief too. You deserve to understand your own body. And you deserve care without judgment. So if you take nothing else from this video, take this. You are not alone, and this is not your fault. Here's something I've always found interesting. Some men who experience this tell me they feel less sensation overall. Others say the sensation is exactly the same, just no fluid. Why do you think that is? Is it the nerves, the muscles, the brain's interpretation of pleasure? I have my theories, but I'd love to hear from you. Drop a comment below and tell me what you've experienced, or what you think is happening. Let's figure this out together. Let me answer a few questions I get all the time. First, is this permanent? Sometimes yes, sometimes no. It depends entirely on the cause. If it's medication related, stopping or switching the medication might reverse it. If it's nerve damage from long-term diabetes, it's harder to reverse, but not impossible to manage. Timing matters. The sooner you address it, the better your chances. Second, does this affect my masculinity? No. Full stop. This affects plumbing. It does not affect your worth, your manhood, or your identity. You are not less of a man because your body works differently. Third, should I stop being intimate? Absolutely not, unless there's pain or discomfort. Intimacy is healthy. Connection is healthy. Pleasure is healthy. If this condition isn't causing you harm, there's no medical reason to stop. And in some cases, staying active actually helps maintain pelvic muscle tone. The goal isn't perfection. The goal is understanding and adaptation. All right, let's bring this together. If you climax and nothing comes out, here's what you need to remember. Sometimes it's normal aging, muscle tone, medications, past procedures, no cause for alarm. Sometimes it's a warning, sudden changes, weak sensation, pain, or blood. Those require attention, and often it's retrograde ejaculation, semen going into the bladder instead of out. Common, manageable, and often tied to blood sugar or medication. The key is knowing which one applies to you. If this video helped you, if it gave you clarity or peace of mind, or just a reason to pay attention, do me a favor. Subscribe to Dr. Alaric, Men's Health. I make videos like this every week to help men understand their bodies without the shame or confusion. And share this video with a man who won't ask, a brother, a father, a friend. Because the men who need this information the most, they're the ones least likely to search for it. Drop your questions in the comments. I read them, I learn from them, and sometimes they become the next video. Take care of yourself, you're worth it. One last thing. This video is for education only and does not replace personalized medical advice. If you're experiencing any of the symptoms I described, especially the warning signs, please see a healthcare provider. Your health is not something to guess about. Thanks for watching. I'll see you in the next one.